and I extend a warm welcome to everyone joining today's conversation. Please share in the chat your thoughts about this programme and email mindhealth@rotary.org to share about your mental health efforts. Over to you, Lauren, to lead us through today's conversation.
Thank you, President Gordon, both for the warm introduction and for your courageous leadership on this issue. I'm Lauren Fields, the Program Specialist for Programs for Young Leaders at Rotary, and I will be serving as your moderator and host for today's program. I'm delighted to be joined by 3 Rotary members doing incredible work to create hope for Rotary members and the people joining us in our efforts to prioritize mental health. A quick note to our viewers watching live on Facebook, LinkedIn, and YouTube. This is a live event, and we encourage you to ask questions. We'll do our best to get to them, but if we don't, we'll answer them afterwards. And if you would prefer to ask a meeting participant or President Gordon another mental health-related question, feel free to do so at mindhealth@rotary.org. Joining me today is Glenda Dela Cruz, a medical professional from Canada who now lives in the Philippines. Glenda is a proud Rotarian and an active member of the Rotary Club of Tiaong-Hiyas. Glenda was her club's president in 2022-2023. She was key in organizing a Rotary Community Corps, which focuses on supporting and empowering marginalized mothers, which has now evolved into the creation of a holistic wellness center that prioritizes mental health. We are also joined by Dr. Athena Trenton, the executive director, because her project is already garnering attention in the Rotary world. President Gordon, in fact, mentioned your maternal mental health project in a Rotary magazine column last October. So Glenda, tell us about how your club worked with a Rotary Community Corps to develop a project prioritizing the well-being of mothers and how it evolved to include mental health services.
Yeah, I would love to share that. So I guess to answer that question, I'm going to have to start with really how the Rotary Community Corps Ilaw ng Tahanan came to be. So the work with them started back in 2022, 2023, where it really began with a disease prevention service project. And it was a 12-week health challenge with this group of mothers, and we started with pre-challenge we started with laboratory testing for some basic blood work, pre-challenge and post-challenge, and then during the 12 weeks there was coaching and mentoring. And so during the 12 weeks, the relationship amongst the mothers kind of developed and friendships came to be. And towards the end of it, they were actually the ones who wanted to continue on being together, spending time together. And so they had asked me, it would be such a shame to stop the camaraderie, the relationship that they have built. And at that time, I came across the Rotary Community Corps. It was presented at one of our district's event. And so I presented that to them, and they were actually the ones who wanted to form the Rotary Community Corps. And so they ended up being Ilaw ng Tahanan. And so the support that the club has provided, has given the RCC Ilaw ng Tahanan is really in so many different levels, from funding some of their projects, but also just trusting that the work that's being done is something worthwhile, because it was something new. The work that they were doing, the work that we were doing, is something new in the community, probably something new in the region. And so nobody really knew what was happening, but they just saw that it was working with these mothers that were continuing to meet together, working on themselves, improving themselves, and showing up and saying that this group, that this work that they're doing together is helping them be better mothers, right? So so the ongoing support from the beginning till now has been from funding projects, from mentoring and coaching. And then to this point, I guess I'm going to share where they're at now. This is like almost 2 years later, where we actually have a physical space where it's going to be a holistic wellness center for the mothers to come to get peer support. The mothers are going to be trained as peer support workers, so really providing mental and emotional support for one another. And this wellness space is also going to provide a variety of things, because we know that mental health, the different factors that affect mental health are, some of them are, financial reasons, or sometimes it's just really personal skills that they need to develop, or just communication and all that stuff. So this holistic wellness place will have livelihood programs, personal development, skills training. And I guess to just kind of sum it all up, another support, not just at the club level, that I want to share is at the district level. The district governor that we had 2022-2023, Governor Gina C., she had applied for a global grant, and I just heard today that this is going to push through. So the vision of having a space for the mothers to come to a space where they're going to be supported mentally and emotionally, the vision of having a computer center, a physical activity center, salon and spa for their livelihood, it's all gonna unfold, right? So so the support has been so much from the club members and also from the district, and the mothers are really quite excited because they feel that that they are supported in all kinds of ways, and we continue to meet, and really just working on those, I guess, personal skills, improving themselves, right? And we're partnering with other organizations here in the Philippines. We're creating a peace hub with a local meditation center. So lots of support that's happening, and it's all for the, to push forward this mental health support for the RCC Ilaw ng Tahanan, and all the other things that they're doing. So in a nutshell, that's how they're being supported. So thank you, Lauren.
Thank you, Glenda. This project is a great example of a Rotary Club building a strong relationship with community members, which helped them better understand the community's priorities. Together, you designed a project based on evolving needs. It's such a great example of a long-term relationship that was formed to address one need and then evolved and grew based on continued feedback and leadership from within the community. It's also a great example of what clubs can do to advance access to mental health care. So, Glenda, I'm curious, what inspires you to do this work?
Yeah, what inspires me to do this work? There's so many things that inspires me to do this kind of work, but I guess I'm just gonna share two things. One is that back in 2014, I witnessed my son develop a psychotic episode, acute psychotic episode into 2014, and it was really difficult. And so, 2014 to now, such a big difference for me. But at that time, I was really, I was lost. I was thrown into, my world was kind of flipped upside down. So I guess I don't want, from that experience, if I could do something to alleviate another mother from having to go through what I went through, I would. So that's one of the inspiration that I do this work, because I know that if there is support, the outcome for any sort of health challenge is better. And so that experience alone, I wouldn't want any other mother to go through that. And so that really pushes me to keep going and work with these mothers, and work with anyone to help them understand mental health better, and also to be better supporters. Another thing that probably I would say at the top of the list that inspires me is the stories that I hear from the mothers, the ones who have joined the RCC, and they share the same thing that I share. I shared about myself is that when they do this work that we do, they have said that, you know, they have become better person, better mothers, better wives. They're able to, you know, go out there, have more confidence, take opportunities, engage in, you know, different kind of activities that they haven't really participated in before. So it's so inspiring to hear those stories of triumphs from these mothers, and so I'm just really inspired to just keep going, and one mother at a time, bring them into the Rotary Community Corps, and yeah, just keep doing the work.
Thank you so much for sharing that, Glenda, and for sharing your personal story and for your commitment to this cause. And finally, Glenda, please share your continued plans for prioritizing mental health.
Thank you, Lauren. I have so many plans, but you know, I believe, and this is the same thing as Philip had said, you know, for me to be able to continue the work that I do, it's all about self-care, right? So taking care of myself, that's at the top of my list of things to do, taking care of my own mental health so I can actually do what I want to do. But in terms of plans outside of me, there's actually a lot of things that's unfolding right now as the RCC Ilaw ng Tahanan is, you know, a lot more people are hearing about it. A lot more people are hearing about the work that I've done with them. And so there are invitations for like another region here in the Philippines where we're being invited to do work with them. And so what the plan is really taking the mothers of the RCC Ilaw ng Tahanan and bring them to the region, to the other part of the Philippines, to actually start an RCC, their version of RCC, with the mothers leading that training. And so I'm just going to be continuously supporting the mothers of the RCC. Also, within our district, mental health is becoming a priority. So this coming year, we're continuing the work of raising awareness and supporting the incoming officers for all the clubs here in the district. We're going to be doing some mental health training. Also, we're going to be doing training for responding to crisis, suicide intervention, so all sorts of different things. But it's all opening up because of this work that we've done the past couple of years. So lots of plans, and I'm just really excited to keep growing, keep pushing forward, and hopefully connect with more people so that there's more collaboration that happens. So I'm really excited about what's coming up. So thank you.
Thank you, Glenda. And thank you all so much for sharing your time, expertise, and experience with all of us. And thank you again to President Gordon for championing this vital initiative. Finally, thank you to all of you watching for joining us and engaging in this dialogue. Remember, you can ask questions here online or by emailing mindhealth@rotary.org. You can also find more information about the mental health initiative on rotary.org. Finally, we'd like to take this opportunity to remind everyone that the mental health focus can and will continue into the future Rotary years. Rotary encourages members and clubs to continue and expand mental health projects and suggests you join or partner with the Rotary Action Group on Mental Health Initiatives to continue this vital work. Thank you all again for joining us today.